This week marked the arrival of the NCPA's new president and CEO, Alan B. West.
But the most important thing about NCPA and what we want to do here is to advance American growth, opportunity, and the promise of that dream for our future generations, our children and grandchildren.
This week at the National Center for Policy Analysis, we are pleased to welcome Lieutenant Colonel Alan B. West as our new CEO. The very first thing that he did was speak for one of our sister organizations, the Texas Public Policy Foundation in Austin, Texas. And everyone was delighted to have him on board here at the organization. There are two things that you need to know that are coming up. One is there are great volunteer opportunities. We want to engage more people with the organization, and we look forward to having you involved. And also, if you happen to be in the Dallas-Fort Worth area, if you'd like to attend a policy briefing to learn a little bit more about what we do here at the NCPA, just let us know. You can go online and sign up, or you can call us here at the NCPA offices.
NCPA Senior Fellow Devin Herrick's latest study recommends that the state of Texas stand firm on rejecting Medicaid expansion, which he warns would come back to bite Texans in their wallets.
With the opening of the Texas legislature, advocates for Medicaid reform have renewed their calls to expand the Medicaid program. But Texas made a wise choice to forego the cookie-cutter expansion in favor of a more tailored program because costs would rise in future years. Texans have a better option. Many low-income Texans have access to private coverage in the health insurance marketplace where subsidies are very generous and coverage is far better. They would lose this if they are forced into Medicaid. The state of Texas, or any other state for that matter, should work toward a unique program that meets each state's specific needs and not go after the cash grab of Medicaid expansion.
And D.C.-based Senior Fellow John R. Graham authored a study that determined bundling Medicaid with other safety net funding into Representative Paul Ryan's proposed Opportunity Grants plan would improve the outcomes for both dependents and taxpayers.
The federal war on poverty is over 50 years old. Every year it spends more and more money, and it achieves less and less for the poor. Paul Ryan has made a very important proposal to bundle together a number of disparate federal programs. There are programs for housing, there are programs for education, there are programs for job assistance. All kinds of programs, they're disconnected, they're disorganized, and therefore they don't achieve much. There's no reason for poor people's health care to be kept in a silo separate from their opportunities for education, for finding a job, and for housing.
From Capitol Hill, NCPA Legislative Director Brian Williams updates the latest following the opening of the first congressional sessions of 2015.
I'm Brian Williams with the National Center for Policy Analysis up on Capitol Hill today, where the 114th Congress has kicked off. Among their first items of business on their legislative agenda is a bill that would authorize the construction of the Keystone Pipeline. The Senate Energy and Natural Resources Committee voted 13-9 to approve the bill. The Senate will vote on it next week. The House is expected to pass it today. Constructing the Keystone Pipeline would create 42,000 jobs at a time that we desperately need them. Building a pipeline that would stretch from Canada all the way down to Texas, carrying about 830,000 barrels of oil a day. The only real hang-up is the President of the United States, who has said he would not sign the legislation. He's made those promises to some of his environmental donors. But whatever the President decides to do, NCPA is here in Washington advocating good free market projects and principles like the Keystone Pipeline.
Thank you for your support of the NCPA and the important work we're doing.